Okay, we have the lines muted. We're going to start up here. Thank you for joining us today. We are happy to give a little presentation here on health information exchange for long-term cares and for skilled nursing facilities. We have Cindy Filippini, who is going to do our presentation. She is an RN. She's a clinical informatics advisor with the Nebraska Health Information Initiative, or NeHII. Cindy has over 30 years of diverse nursing background. Her clinical years, she was in Pediatric Trauma and ER. Subsequently, she went to PACE management, quality improvement, and health information technology. In her previous position, she worked with us at Wide River Technology Extension Center, the regional extension center for Nebraska. And Cindy filled in as the role of a HIT clinical advisor and was also a quality assurance lead. She served the clients directly with on-site technical assistance and training of the eligible professionals and staff in utilizing certified EHR technology and assisted them in achieving meaningful use. Cindy then joined with the NeHII team and is assisting the providers in addressing their participation in NeHII and is actively training new users on the NeHII Virtual Health Record and promotes the other HIE services. Cindy is an advocate for high-quality health care, patient safety, and the use of HIP. So welcome, Cindy.
Great, thank you. And as Jane mentioned, I've worked with Jane and Jody in the past through efforts with Wide River Technology Extension Center in Simro, and it was definitely my pleasure. I'm now part of the NeHII team working on the health information exchange for the state of Nebraska. And my goal today is to present the virtual health record to you for consideration for long-term care and skilled nursing facilities use. And I'm hoping that you'll see a value in the use of the virtual health record and perhaps other services that your Nebraska Health Information Exchange can offer. Beth Ash, who's our CEO, will be on the phone towards the end, and she'll be open for questions. She has a pretty full day, so I'm hopeful she'll be able to join us. If there's any questions I can't answer, I'm sure Deb will be able to. And if she's unable to attend, then I'll certainly jot down questions and get back to you on that. I've been with NeHII for 3 months now. I am so proud to be part of the team. Health information exchange, and I'm sure you've heard this term before. It's about seamless exchange of health information, and I want to take it a step back into health information technology, which is a broader term of all forms of information technology used in healthcare. My background in nursing is well over 30 years, and pediatric trauma and quality, and I can recall medical records that were simply a 3x5 card. And it was a way to communicate between visit to visit. The physician would document notes, just basic notes regarding the patient's care. And then over time, the medical record developed into a more sophisticated paper chart. I can remember when problem lists and summary lists came out, and that was quite exciting. And then eventually your electronic health records. However, there's still quite a few paper charts. And then a lot of times they'll be hybrid, where you're using paper medical records and electronic health records. And then the step above that is actually an umbrella, your health information exchange. NeHII is the Nebraska Health Information Initiative, and it has been in place since 2009. It's a nonprofit organization. The collaboration has actually started in 2005 developing, and they had to have all the policies and procedures in place to move forward. It's an umbrella. It's over, if you look at our efforts within Wide River, we had implemented or supported rural Nebraska and implementing electronic health records. And then with the Health Information Initiative, it's the umbrella connecting those and allowing physicians to communicate or receive virtual health records from participating providers. The importance of health information exchange is really to improve health care quality and safety. It reduces redundancy in records. It shows the patient in a more complete view. You might have a virtual health record where the patient has been seen at multiple locations, and it's available through the virtual health record at the point of care. Like I mentioned, it reduces redundancy in services. A patient, when they're under stress, especially with my background in pediatric trauma, when a patient or family comes into the emergency room, they're often horrible historians. And to have the virtual record available, you're able to see their problems, health history, medications, that type of thing, the more complete picture for continuity of care. It also helps reduce operational costs by eliminating duplicate tests. A patient may have had a lab at one facility, and then rather than repeating the lab, if you pull up the virtual health record, you have a complete list of the laboratory results and radiology and that type of thing. It's a way to manage the exchange process of data. This is our website, and it's a lot of information on here, wealth of information. I would encourage you to go ahead and access this, NeHII.org. And I want to point out our mission, back to basics kind of thing, and it aligns very well with CIMRO's mission as well. The mission for NeHII Collaborative is to provide Nebraska a system for the secure exchange and use of health information. Our goals are solid as to we want to be able to share timely and accurate patient healthcare information in a secure environment to improve patient care. Of course, we're HIPAA compliant. We take that a bit further. In order for a provider or staff member to access a virtual health record, they need to have a treatment relationship with that patient. We also have the virtual health record available for payers, and they can only access patients that they actually cover in their policy. So it's a seamless exchange of health information, and as we go through the presentation, I do have some screenshots to show you how simplistic it is. Many electronic health records are very verbose and difficult to learn. The virtual health record is very, very simplistic. It's read-only, and we'll go over that a little bit more as Health Information Initiative, statewide approach. What sticks out to me on the principles is keep it simple. Keep it so people can understand it. We have a lot of technical slides here, and I'm trying to present this a little bit higher level to pull in what the value is and how it would be useful in long-term care and skilled nursing facilities. The map of NeHII adoption is quite exciting. We actually have facilities within NeHII from western Iowa all across the state of Nebraska. You'll see the green are implemented, the pink have implementation schedules or signed participation agreements. We still have a lot of work to do, a lot of cities and counties to get on board with the health information exchange. It initially was for the state of Nebraska, but western Iowa showed such interest because a lot of their patients will come to Omaha for care, so it's a way for them to access those records. And same with Scotts Bluff. There's people from Colorado that come in. So we're hoping to get the entire state connected through the health information exchange. Now, the history of health information exchange, you may recall HIPAA, which was back in 1996, the Health Information Portability and Accountability Act. It was an attempt to improve U.S. healthcare value. So it originated then, and it just continues to grow. As you know that healthcare technology has been a bit behind other industries in the nation, and certainly banking has quite an edge on technology. And eventually the Health Information Exchange will be part of the nationwide Health Information Exchange, and there's efforts going on with that development. Of course, that is supported by the Office of the National Coordinator. So anyway, this map is, hopefully within a few years we'll see even more on there. Like I said, I've been with NeHII for 3 months. I've been watching them grow since 2009, and I'm very proud to be part of their team. I definitely see the value, not only professionally but personally. Of course, as our parents age, It's wonderful to have that virtual record available rather than having to carry that medical record. And I know with my own experience having family members admitted to nursing facilities, they don't always have the complete information. And by being a participant in the Health Information Exchange, you'll be able to access the virtual health record. This is available on our website, and this is a list of the hospitals that are currently implemented with NeHII, so the virtual health records on the patients are available. I do want to mention that it is an opt-out model, which means that patients that are cared for at these facilities are automatically part of the NeHII system, so they don't have a virtual health record unless they take action to opt out. We also have payers and pharmacies, and there's a list of hospitals that are implementing as well. Our physicians that participate or access the virtual health record, can you scroll down? You can see who's available or what providers actually utilize the health information exchange. And certainly I've talked to a number of patients and staff members, and since the health information exchange is becoming more widely known, patients will often seek out a provider that is part of the health information exchange. You know, if you live in Omaha and you go to the rural area, you want to be able to have your records available. And certainly we have a lot more work to do to get everybody connected, but it's a work in progress, and I'm really proud of the efforts they've done so far. Data flow. This is a slide just to show you how a health information exchange works for NeHII. It's a Ulysses EMR hub, and it's a query model. So we don't store the medical information, the medical record. It's simply a query. The hospitals, facilities are implemented, so when a patient is seen by a physician in the office, the physician can do a query and obtain radiology, laboratory, medication, and that type of information. Privacy and security, I can't say enough about that. We all know about HIPAA, and NeHII takes this very, very seriously. It's all of our responsibility to protect patients' information. So when new virtual health records users are trained, we do have a very stringent HIPAA policy through NeHII that they must agree to. And basically, they have to have a treatment relationship with the patient in order to look up the record. We have a security officer. We have audit trail who's monitored very, very closely. Of course, there's always concerns with privacy and security, but we do our best, and so far we have not had major data breaches. If there is a suspected breach, our users are trained to make sure they notify NeHII right away. We also have part of the DURSA agreement, which allows us to exchange data across state lines, which, for instance, Omaha to Iowa, that type of thing. Consent management. I had mentioned that we're an opt-out model. There's two different types of HIEs. Opt-out is where the patients are automatically in unless they opt out, or opt-in is where a patient is seen and they can choose to be part of the HIE. Nebraska Health Information Initiative did choose the opt-out model, so the patients are educated when they check into the facilities that they are a participant. The hospital is a participant in the NeHII program. So the patient's records will be shared unless the patient takes action to opt out of NeHII. Now, when they do opt out, their records are still in the query, but they're blocked. And the reason for that is our opt-out rate is very, very low, which thankfully it is. It's over 2%. And of that, over 6% will opt back in. So by having them blocked when they opt back in, those records are available. Now, break the glass consideration would be the situation where you're in the emergency room and you have opted out and you need your record right away. We do not have that consideration. You have to go through the process of opting back in. And we're hoping to get the the message out to patients that this is a value service, and if you're in an emergency situation and you've opted out, the records won't be available. We respect your decision to opt out. Not a problem. There's a website, there's a phone number. You can call to opt out, but majority of patients that opt out will opt back in when they find the value of it. We also have special protected data, such as behavioral health, which is not obtainable through NeHII, HIV testing, genetic screening, that type of thing, because it's protected by law. Consumer education is extremely important, and when the patients check into these facilities, we do have a brochure that explains what NeHII is, HIE, what information will be shared, what will not, and then the opt-in, opt-out criteria. As for flexibility of consent, again, it's the patient's responsibility to opt out if they choose to. Otherwise, their records will be shared, and it really does support the continuity of care. Like I said, when patients are under stress or family members, they're not the best historian. So they have a complete record as a tool. And, of course, I say it's as a tool because not all facilities are in NeHII. But the facilities that are participants, those records will be available, your transcription, radiology, lab, and so far. And we'll go over the virtual health record in just a little bit. Consumer awareness campaign. This has to do with making sure our patients are aware. We do have stickers for windows and tabletop tents for participants that are in NeHII. We also have public service kits for radio. The patient brochure I mentioned is very, very complete, and it's written at a 6th grade level, so it's very easy to understand. Also have a YouTube video that we're going to show in just a moment, and then our consumer website. And I think we're going to go right to the consumer website on the next slide. There it is. Okay. ConnectNebraska.net. This is our consumer side of NeHII. So if patients have any questions or they want a little bit better understanding how health information exchange works, they can certainly access this. And when new hospitals implement with NeHII, I often encourage them to loop our Connecting the Docs video in their waiting area. It's very simplistic, and it gets the point across as to what the value is of connecting the docs. So, Jody, do you mind starting that video?
Not at all.
From Scottsbluff to Omaha to Western Iowa, the aim of each and every person is staying healthy. Of course, this all begins with your annual checkups with your regular doctor. But it can also mean a handful of, unplanned hospital visits now and again. All said, there are multiple times through the years when you come in contact with the healthcare system. This includes your family doctor, as well as walk-in clinic doctors, pharmacists, and even emergency room doctors. Each of these doctors has important information about your health, whether it's x-rays, prescription history, or other medical documents. Doesn't it make sense that your doctor should have easy access to your health records that are in other locations, regardless of the doctor, and regardless of whether it's information from a simple physical exam up the street or surgery at a hospital across the state? And that each authorized doctor who treats you has secure access to your complete health records? Here in Nebraska and neighboring states, we call this connecting the dots. By connecting the dots, physicians involved in your care have private and secure access to your lab work, medications, allergies, and existing conditions, all at no cost to you. However, when you're not connecting the dots, you're not getting the best health care. When the dots are unconnected, you could spend hundreds of dollars and hours of your valuable time on examinations that aren't even necessary. That's why it makes perfect sense to connect the dots with Nebraska's electronic health record system. By connecting the dots, you get the best possible health care through shared communication and collaboration. Brought to you by your friends at the Nebraska Health Information Initiative. For additional information, visit www.connectnebraska.net.
Wonderful. Thank you, Jody, for playing that. NeHII is one of the first statewide HIEs in the country. It started with pilots in 2009 with 4 major health systems. Today, I'm happy to report we have 2.7 million lives with virtual health records in NeHII. And if you look at our census in Nebraska in 2012, it was 1.8 million lives. So we have a lot of patients that come from out of state into facilities that are participants in NeHII. We're also one of the first to offer fully functional e-prescribing, clinical messaging, and physician referrals. We have one of the most effective virtual models in the country, and my position with NeHII is a clinical informatics advisor, and I'm actually the trainer for the virtual health record. We had originally intended for treatment and payment purposes, but we're now adding public health reporting and healthcare operations, such as giving users access for quality assurance purposes and to meet meaningful use requirements. So I mentioned that the pilot was in 2009. It completed in June 30th, 2009. It's a hybrid federated model, and if you recall, the slide is a query model. We don't store the data. It's simply by query. And HIPAA compliant. The Lithium software is developed by Axolotl. Our website is www.nehi.org. The statewide rollout began in July 2009, and as a state-designated integrator received, that is, we were recognized as the state of Nebraska's Health Information Exchange, and we also received our nonprofit status, too, in 2009. Our business model is nonprofit. We're owned by the NeHII Collaborative. It's maintained by the Board of Directors. Operational fees by participants help maintain our sustainability. And during the implementation phase, there were a number of different grants and funding and fees that supported NeHII. As of January 3rd, patients in the system, well over 2.7 million lives. We have 1,396 physicians, almost double staff. You know, your clinical staff, radiology, pharmacists. We also have some support staff that will access the virtual health record when they're preparing the medical records for the physician to see the patient. Very, very quick. Response time is within 2 seconds and 97%. We have over 60 million results in NeHII, lab, radiology, and transcriptions. Here's just a graph, a visual for you, total users. And you can see how it's evolved over time since 2009. And demographic information, that would be the patients in the system. Like I mentioned, we have over 2.7 million patients. So we continue to grow. And results in the system, greater than 60 million results. And again, you can see the graph, it's just continue to grow. And now we have the virtual health record, and it is my pleasure to walk you through this. I want you to see how simplistic it is. I know majority of healthcare facilities, long-term care, nursing home facilities do not have electronic health records, and they can be rather intimidating. But the virtual health record is read-only. It's very, very simple to access. Of course, it requires a participation agreement and security clearance for the users to make sure they're authorized to access the virtual health record. It's actually accessed through the computer over the Internet Explorer. So you don't even have to have an electronic health record in place. As long as you have Internet Explorer, you'll be able to access the virtual health record. So on this screen, once you log into the Axolotl system, simply click on the login button, and it'll bring you into a sign-in screen. Every user will have a unique user and password, and the password is set up initially as a temporary password, and then the users will select their own password. And, of course, like any other HIPAA security, you don't share your user ID or password. So every user needs their own sign-in. This is the virtual health record. In order to access a patient or look up a patient, you'll see an icon up towards the top right, the patient lookup. So when the user clicks on that, then they get to look up a patient. And the minimal information to look up a patient is last name and date of birth. And you can see we have a test patient in here. Last name and her date. Our test patient, she's getting up there in age and has a lot of comorbidities, but she's in the system. If you happen to have a last name and same date of birth, you'll see matching results down towards the bottom left. And then what you would do is you would select the appropriate patient. And at this point, you want to be sure you're in the correct patient's chart. So you may want to go to the demographics and verify that indeed is the correct patient before you actually look that patient up. So once you click on Great NeHII, then you come into the virtual health record itself. And you'll see it's very, very simplistic. There's tabs across the top to see all summary, and we're in the summary tab. Cumulative lab, radiology, reports, ADT, and patient information. The results can be accessed either by clicking on those tabs or the file folder above the categories. For instance, you see a file folder for lab and reports and radiology. There's also a scroll bar in the middle of the screen. That just indicates that there's more than 5 results. So if you click on the actual tab, it'll bring you into all the results. So let's go ahead and click to the next screen, and we are now in the lab tab. And these will display all of Great Bee's labs. And they are from multiple facilities. And you can see from and to, they're all combined together. You'll see yellow triangles to the left. That indicates that the lab is abnormal. And what the Unisium axolotl system does is, as we get the labs from different facilities, it actually formats it in a very structural way. So the font is very user-friendly. It's very easy to read. The layout is very consistent, no matter what facility these results are coming from. So if we go into lab and scroll down a little bit, you'll actually see a lab result. And you'll see the basic demographics, who ordered the results, and you'll see blue arrows indicating that the lab is low, or red arrows that the lab is high. The ranges are set by the facilities. We do not manipulate any of the data. We just make sure that it's formatted and very easy to read. Now, you may see ranges on the same lab being different from facility to facility, and that's based on the facility and their calibration. Then the next tab over would be, cumulative lab. We're going to go back one. There we go. Cumulative lab is a way to see all of the labs, and it does trending. It does one code trending on 140 labs. So on this screen, you'll see that I selected all elements and time range all, only because I wanted you to see the whole record for Great Bee NeHII. On the left of the result, you'll see a box. And when you click on that box, what it'll do is it'll pull up and graph all the labs together. So multiple facilities graphed together, you can see the entire picture of what's going on with this patient. Then the next tab is your radiology results. And those results will be the transcription or the actual result. We don't have imaging right now. It's something we're looking into. However, the technology for that is it's pretty new, and it's not crystal clear to go over the internet as of yet, and it's rather costly. But I can imagine eventually imaging would be something of the future as well. So then when you click on one of those results, you can see that it's formatted very uniform, same font, same layout. You have demographics. You have your results. Very easy on the eye. And then the next tab will be your result tab. which will have your OR notes, progress notes, clinical notes, H&Ps, consults. Some facilities will provide OT and PT records as well. And then if we click in one of those results, you'll see the font is, very structured, very easy on the eye, easy to read. You'll always have your demographics, who ordered the results, the name of the test and all. Okay. Next tab is the ADT tab, and this tab is currently in development. And here you'll see your registration of the patients and demographic information and admit information. So ADT stands for Admission, Discharge, Transfer. Go ahead and click on that, and this will show you what it will look like. So it will have information regarding the insurance, and this will be based on each of the facilities when the patient's cared for and admitted, that type of thing. Next tab is the Patient Information tab, and I want to point out up at the top it says Consent to Access. One of the very first screens that you get into on a true patient chart will say consent to access, and if it said no, you'd simply be blocked. You wouldn't be able to get any further. Our test patient did not opt out, so her access is a yes, so we were able to see that virtual health record. You see your demographic information, and then under basic, you'll see MRN or ID, and you'll see a Ulysses ID number. Every patient in the system, or every patient that's seen at a participating facility, will have a Ulysses ID number. As I mentioned, if they opt out, they are still assigned a number, and when they opt back in, then those records will be available. You'll also be able to see all the facilities within the NeHII system that this patient has actually been cared for. You may have a patient that comes in and says, well, I've only been seen at one hospital, and then you pull this up, and you realize, oh boy, this patient's been cared for in a number of places, and perhaps those different facilities are not communicating with each other and providing the best of care for continuity of care. Medical insurance plan by query, pharmacy benefits by query, then allergies. We are starting to get that populated by working with the facilities. This is a continuation of the patient information tab. Medications are actually available through the query tab, and it's based on DEA number, and I'll show you that on the next slide. Problem lists, we're starting to work with facilities to get those populated as well. And public health reporting is a work in progress. You see at the very bottom, advanced directives. Now that's one that I'm pretty proud of NeHII. They've listened to facilities and the importance of advanced directives. So that is currently being developed. If you scroll up to the top, Jody, you'll see, let's go to the next one. Can you go back some? Sorry. There you go. I wanted to show you on the bar. It says Open Report on the far right. That will become advanced directives, which I think that will be very, very helpful for long-term care and skilled nursing facilities. Once the patient arrives, you really need to have that in place. If you're just asking them and for power of attorney and that when they're in the hospital in a critical situation, it's almost a little bit too late. We need to make sure that we're a little bit more proactive in having that available. So I'm really looking forward to them populating that. So I had mentioned the medication query. The medication query is populated through major pharmacies, through SureScripts. Now, SureScripts has 96% of the prescriptions in Nebraska, and we also get self-pay information from that feed. Medication query is also populated by the major payers such as Blue Cross Blue Shield and Coventry. Now, this is an example of a blinded actual inquiry, patient inquiry, or query on a patient. And you may see medications that are listed twice, but they're identical. And the reason for that is we're capturing it from SureScripts, and we're also capturing it from the payers. But it's very, very complete information. You'll be able to see the drug, the quantity refills, when it was filled, the pharmacy who wrote the prescription, and the source. You see there that was sure script. In prescribing in Nebraska, there's 96% of pharmacies that participate in sure scripts. 89% of physicians use e-prescribing. October 31st, 2013, DHHS did approve the prescribing of controlled substances. Now, it's very, very controlled, and there's many identifiers that are in place. HIE Pharmacy and limited independent pharmacies do have the certification to be able to process controlled substances. The very first tab on the virtual health record is the All tab, and that'll list all the results. And the reason I pulled this slide up is I wanted you to see the functionality of sorting. It's very much like an Excel document. So if you click on the word result above the column, the first column there, it'll sort it in alphabetical order for you. There's an example of the sorting function down there. Or if you sort by, ordered by, it'll put it in alphabetical order, or clinical date. That too will be in alphabetical order. Testimonials. That's one thing. I'm always open ears, and when I'm working with new users, I'm trying to get new stories. I certainly have plenty of stories from my past, and I wish I would have had the virtual health record in the pediatric trauma area. It would have just made, it just would have made a world of difference. On a personal level, too, I'm parent of an immune disordered child, and when she was younger, I had to carry her medical record from place to place, and with the virtual health record, it's accessible. So now that she's older, I've made sure that she's seeing a physician that actually has access to this for her care. So the first testimonial talks about the importance of electronic access of medical records. Obviously, they're still on paper charts, and receiving faxed information from a facility, 500 pages for one patient is not that unusual. And then when you consider if you have a fax error and it's refaxed plenty more times. So this particular testimonial has to do with, boy, you can really see the value of having a virtual health record and secure messaging, that type of thing. Patient in the emergency room, when you pull up their electronic health record, they could see that they were within 3 hospital systems, but once this particular provider went to the virtual health record, this patient actually had 33 ER visits in 12 months. So they were, traveling a bit, and all of those 33 visits aren't being communicated. The continuity of care is broken down. So the virtual health record certainly helps connect those. And how timely the virtual health record is. When facilities are implemented, it's real time. So once they're on board and they're participating and sharing their data through query, once that transcription or lab result is available for the provider at that site, it's also available to NeHII. So it's real time, so to say. So this particular testimonial, they had a patient that was seen in an emergency room and claimed he had never had any care, and they went into the virtual health record and found out he was actually just seen at another facility 30 minutes prior. So value for providers, they access health records within seconds. So keep in mind that it's a tool. So if that patient was seen at a facility not associated or participating with NeHII, we would not have those results. It avoids redundant tests and delays. You could have a hematocrit done the day before at another provider. The patient's a horrible historian, an elderly lady, goes to another provider and can't remember what tests were done. So within the NeHII system, you'd be able to access that. Verify medication history. You saw the medication query. And there's often delays in medical treatment or treatment plans because you're waiting for medical records. Now, when a patient's seen at a facility, often the process is you get a consent, you send the consent signed by the patient over to the other facility, then you get your medical records, from the medical records department. With a virtual health record, you would log into the system, you verify certainly that that's the patient you want to look up and view their virtual health record, and then that data is available to you. Secure exchange of health information and trending results. You saw that with the labs, the white coding. 140 labs are coded to be able to provide that trending for you. Value for consumers has to do with education. And I cannot stress enough, once these patients realize that it's of value, they often opt back in. And our opt-out rate is very low. The patients that opt out are more of a red flag nowadays. In fact, if patients know that physicians on NeHII and perhaps they're drug seeking, they'll often go somewhere else because of the connectivity, the continuity of care, the records that we have in place. Medication history is available from the pharmacies. You don't need to carry your health record. Like I mentioned, my own personal experience. And consumers become empowered too and become actively involved in treatment plans. When a provider or even the nursing home, when they pull up that virtual health record, you have more of a complete story that you can share with the patient and perhaps even gain more information from that patient, acknowledging, oh, yes, I did have that, or, oh, I did forget about that medication, and perhaps they weren't even taking that medication. Our consumer website is www.connectnebraska.net. And you saw the YouTube video. It's very simplistic. I think it's a very powerful video. And, as you can see, it goes from western Iowa all across the state of Nebraska. We have facilities in Red Oak and Cache County and Omaha, Hastings, all the way to Scottsbluff. And I'm happy to be part of the team to try to get the rest of Nebraska on board and having providers and staff utilizing the virtual health record. We also have a direct messaging system which has secure encrypted email services to support communication between healthcare providers and patients. Also supports stage 2 meaningful use. Optum is now a member of Direct Trust, and they'll be getting full accreditation for that service. If you need any additional information from that, I can certainly put you in contact to the project director of that effort. It's basically X to fax. You're doing secure email rather than faxing. There's more and more concerns about fax, medical records being faxed and ending up in the wrong location or in the wrong hands. So this is certainly a way to keep those secure. And for transition to care, direct messaging, the push and pull query model of the virtual health record certainly supports transition to care, continuity of care, and also attestation for stage 2 transition to care. Value for long-term care and skilled nursing facilities. I can't say enough about the virtual health record. It's so simplistic. And as a trainer, I really sincerely hope that your facilities will consider implementing or being able to be part of NeHII. There's a wealth of information there at your fingertips, and it's secure, it's protected. Again, it takes all of our diligence in protecting this patient information. The medication query would be helpful if you have a new admission and not quite sure what medications they're on. Certainly through SureScripts in the query, that's obtainable. The ADT messaging, admission, discharge, transfer messaging, we spoke about that. The direct effort for secure email and overall care coordination. That's what health information exchange has to do with healthcare. Keeping people connected, making sure doctors can care for that patient with the most complete picture that they have of the patient. Okay, we have questions and answers.
Okay.
Done. Hey, Dad.
And we are going to unmute all lines, so we will be open for Q&A at this time.
All lines have been unmuted. This is Deb. I am on the call.
Okay, thank you. Wonderful. Do we have any questions out in our facility group out there? Do we have any questions or comments, or do you have any experiences you'd like to share where either NeHII or the Health Information Exchange could have helped in a situation, or in the case of you're using the HIE and how it has helped? Bueller? I don't see that Jim has been able to join us. I don't know if it's due to weather or you never know. Sometimes we have last-minute things that come up in our facilities. I guess as one area that I can see that this is a huge value is that virtual health record and being able to see those medications, possibly the faxes. I know there's still a lot of facilities out there that are doing the faxing. And the faxing back and forth can get very ugly. It gets very messy. And I think by going in there, you would get a really nice snapshot, especially looking at, has this patient been in the system for a long time? Basically, maybe somebody who's been in a hospital repeatedly over the last couple of months, and now it's come time that they need to go to a skilled facility because they need more assistance. What are you really getting on that snapshot when you get that transition of care, and you might see a 24-hour, what has happened to this patient in 24 hours? Well, what about the week before? What about the 2 months before? What about the 3 months prior? By going into an electronic health record or into this virtual health record, you will be able to see that their labs, maybe their blood sugar is very unstable, maybe they have had, significant treatments or significant, a procedure. They had a procedure 3 months ago, and they had a knee. And then 2 months later, they had a blood clot. Was that blood clot connected to what happened to them in the past? So you'd be able to look at that virtual health record and truly see the picture of what this patient has been through, and it would give you so much more ahead of time to, before that patient comes into your facility, to be able to really see what has happened and how that patient might need additional help, and maybe they aren't a patient that would be fitting for your facility, or even that you would have better treatment.
I would like to add, this is Deb Bass, and I would like to add just a couple of points, and Cindy, you did a great job of providing that overview. And to build on what you just said, maybe a helpful picture to get in your minds of what the virtual health record is. With the Expedia use that we do when we plan our trips, NeHII is very similar to that functionality. When you decide you're going on vacation, you have a location determined, and you enter that into Expedia, and then all of the information pops up as far as hotel reservations, car rentals, sites, attractions, those kinds of things. NeHII works that same way. You enter the patient's last name and birth date, and we bring up all of this other information. I also want to just make mention that the SureScripts medication query, because that is so important. We just did a provider satisfaction survey, and that is the #1 functionality that physicians access. And by the way, physicians completed the survey and gave NeHII a 63% approval rating, which is pretty good when you're talking to physicians. But what I want to point out is that SureScripts feed comes from the SureScripts organization. So it does not matter whether or not the physician is participating in NeHII. As long as they're using e-prescribing, that information will probably be in SureScripts, and we can access that. So that's really an important point to make, because so many times someone will say, well, the physician I go to does not participate in NeHII, so my information isn't there. And that's true for the labs and the transcription reports, but that medication history, it is there, and that's very important as we look at transition of care models.
That's a very good point, Deb. Thank you.
Deb, you are welcome to share any other, because you definitely have more of the history background of NeHII and the future efforts.
I would just say that I look forward to the day, because just in my travels, and Cindy did a good job of touching on the ADT messaging, that admission, discharge, transfer, and we're adding more information to that all the time. It is operational as we speak, and now we're adding allergies, admitting, working, and discharge diagnoses. And that's for the ICD-10 work that lies ahead, but also for the care coordination and case management for the work that you do in the nursing home and skilled nursing facilities. But, you know, the other piece to that is, and I hear this all the time with those individuals that are taking care of their elderly parents, is that, you know, particularly in a broken, fractured hip scenario, and they're looking for a care facility, their loved one is being dismissed, and it's so difficult for that family to figure out where should we take mom and where should we take dad. And with these ADT messages, I look forward to the day where we can work with the nursing homes to have an automatic, real-time report of facilities and what kind of beds they have available and the steps that are involved in getting a patient admitted to that facility. So please, if any of you have any great ideas along those lines, I think that would be a tremendous value add to all sides of the equation.
Thank you, Deb. And I guess what I wanted to say, this is Jane again, and the last slide you'll see the information on how to reach out to NeHII and how to talk if you want to get information on pricing or how this physically will work within your system. Please feel free to reach out to NeHII, call Deb. You can call us. We can refer your information over to them as well. Again, we're vendor neutral, but we are not opposed to connecting the dots for you. The other thing I also want to continue to stress is if you do not have an EHR or if you are still at the point of trying to do selection, you can use this without having to have an electronic health record in your facility. So it is like that baby step, that first step of being able to see what is going on with your resident when they're a patient in a facility and if they're coming to you, or if you see them as not being a good match for your facility, it gives you a lot more information and it just gives you more background so you're making a decision that is probably a lot more, I guess, educated and you'll feel better about that decision regardless of whether it's an accept or not accept. So, I'm going to open it one more time. Any questions? Any comments? Otherwise, there was a sign-in sheet on the email that was sent out yesterday. If you would please sign that and fax that back in so we can have a record of who was on this call. And that means even if you dialed in and you had 5 people in your room, we want to know that who in your facility was given the education. We'll also have this recorded and should be available within the next week to 10 days on our website, on the SEMRA website, and we will send out an email on that as well. And I guess other than that, I want to thank Cindy and Jody for hosting, and I think that's it. Everybody be careful out there today with our little winter wonderland. Thank you all.